Okay, Brian, we're done with this part. If you want to just have a seat right there, and someone will be in just a couple minutes to talk to you, okay?
Okay.
All right, great. This video is for training purposes only. No real patient information is contained in this video.
Hey, Brian.
Hi.
How are you? I'm Caroline.
Nice to meet you.
Thank you. I wanted to talk with you a little bit. You've already had your shot, right?
Yeah.
Okay, so I just wanted to talk with you about your infection and about what was done today during your visit. But I want to start off by telling you everything's confidential. Can't share this information with anyone else. Got to make sure I'm talking to the right person. So your name and date of birth?
Brian Collins, January 1st, 2000.
Okay. So before I get started, what types of questions do you have?
You're gonna go to work soon. How long is this gonna take?
It's not going to take long, but we do need to do it now. So I'm sure your job's going to understand. So let me find out first too. Your chart says your address is 123 Main Street in
Yes.
Richmond.
Mhm.
And is this the correct phone number? 555-5555?
Yes.
Okay. Do you live with your parents?
No.
All right. You have any roommates?
No.
Okay. And how long have you been at that Main Street address?
2 months.
Okay. Where do you work?
ABC Bank. I really can't be late. How long is this actually gonna take?
Oh, yeah, don't worry about it. It's not gonna be long at all. What is that work phone number?
I don't see why you need that. You have my cell phone. I always answer that. But I really need to go so I don't lose my job.
Well, would it help if you call your boss and then I could give you a note to take with you just explaining that you had a medical appointment? Wanna try that?
Yeah, I can do that. They really don't like when we're late, but I'll call them.
Okay, just give a quick call.
Alright, we're good.
All set? All right. Well, tell me a little bit about yourself then. What do you like to do? Where do you like to hang out?
Mostly I just hang out at home. So I go to Antonio's sometimes after work for happy hour. On the weekends, sometimes I go to watch football games there.
Okay. Football is one of my favorites too. Who's your favorite team?
JMU, I only follow college. I'm starting there in the fall.
Okay. All right. That'll be a fun place. Have you traveled in the past year? You can go ahead.
Yes.
Okay. Oh, so now hold on. Yep. Yes, you could bring me something. Okay. Yeah, wherever. That's great. All right. I'll be free in just a little bit. Yeah, I hope. All right, bye. All right, sorry about that. Where did you go when you traveled?
I went to Vegas a few months ago.
Okay. Fun place. Have you ever been incarcerated?
No.
Yeah, sorry, I gotta ask these questions. Do you ever exchange sex for money or drugs?
No.
Okay, well that's a good thing. A lot of people get STDs, including HIV, from that sort of thing. So let's talk specifically about syphilis, though, your diagnosis. What do you know about it?
You get it from sex.
Mhm.
It's not curable.
Mm-hmm. That's about it?
That's it.
Okay, well, you're partially right. It is sexually transmitted, but the good news is it can be cured, and so that's why you got that shot earlier. That should take care of the infection, but it's going to be important that you come back in about 3 months so we can do another blood test for you. That's how we measure if the medicine worked. Do you know anything else about syphilis?
No, not really. I just came in because this guy told me I should get tested.
Oh, okay.
I didn't really think that I had anything.
Right, but it is good that you came in. Obviously good that they let you know, because the symptoms are so easy to miss, and sometimes they're in a place on your body, in your body, where you're not able to see them anyway. So that's part of the problem. It's really nice of your partner to give you the heads up. Let me tell you a little bit about the infection, though. It works in stages. First of all, a sore is going to show up on the body, in the body, where it has been transmitted from one person to another, and that's why it might be missed. If it's in the rectal area, like this,
Oh, God.
that's not easily visible to the individual, and a partner may not see that. This is a sore on a tongue, but again, you know, canker sores and different things occur, so things can be mistaken for something else. See the crease right there on the mouth. and they're painless to boot. So you don't see them, they don't hurt, very easily missed. And then what happens is, even without any medication, they just go away. So seen or unseen, a person who may have seen something would think then, well, there must not have been anything wrong anyway, because it took care of itself. So, have you seen anything like this, though, on yourself or on any partners?
It's all the time. No.
Alrighty. Well, again, not at all unusual. So after a period of time where there is none of that, a second stage would appear. So now a new round of symptoms of a different sort. And these are some examples of that, like a rash on the trunk, and these are, spots on the hands, typically also occur on the soles of the feet. So how about anything like that? Does any of that look familiar?
I might have had a little rash last month.
Oh, okay. Well, then that would probably have been secondary syphilis. So good to know, because that allows us to kind of judge how long you've been infected, how old this infection might be. But as I said with all of this, symptoms disappear, the disease doesn't. The disease just goes on to do more damage, and it can affect all the major organs. It can affect the heart, it can affect the brain. You may have heard of people going blind from syphilis, because it's in the bloodstream from the get-go. So it can do damage all over. It's really dangerous for a woman who may get pregnant and can pass the infection along to a baby. So what do you think about all this? What questions does this raise for you about everything we talked about so far?
Nothing so far.
Okay. So given all that and what I've talked about with the seriousness, you can understand why it's going to be really important that we talk about partners too, and other people who could have been affected by this. So how many partners would you say you've had in your lifetime?
Probably 20 or 25.
Whoa, okay. And how old are you again?
20.
Okay. How many in the past year?
Oh, 8 or 10.
Okay. And of those 8 or 10, how many of them are men?
All of them. I'm gay.
Oh, okay. All of them. And the last time you had sex?
2 days ago.
Okay. And who was that with?
Mike, the one that told me I should come in and get tested.
Got it. Okay. I'm really glad he told you to do that. What did he tell you specifically about what you needed to come in and get tested for?
Well, he was treated for syphilis at his doctor, but I don't have insurance, so he said to come here.
All right. Good choice. I'm glad he got taken care of then. And when was the last time that you had sex with anyone besides Mike?
About a month ago.
Okay. And that person's name?
It was John.
Okay. And when was the last time you had sex with anyone besides Mike or John?
Like a month and a half.
All right. And who was that?
Tom and Steve.
Oh, okay.
It was a group situation.
Oh, okay. And then when was the last time you had sex with anyone besides Mike, John, Tom, or Steve?
Mike, John, Tom, Steve. Look, I broke up with my ex a couple months ago. I've just been having a good time. I can't remember all of them.
Okay. Well, tell me about your ex then.
His name was Bob. I found out he was cheating on me, and so I broke up with him.
Okay. When was the last time that you and Bob had sex?
Like 2 months ago.
2 months, okay. And the first time?
2 years ago, maybe.
Oh, that was a long relationship then. How can I get in touch with him?
What? Why do you need to contact Bob?
Well, he needs to have the same opportunity you had to get tested. So I can't say anything to him about you. Remember that confidentiality thing I mentioned in the beginning. So I can't tell him anything about that, but in order to, try to make sure that he gets the treatment he needs, I need to contact
I
him.
don't really care if he gets all the treatment he needs. He can be sick as far as I'm concerned.
I hear you. But you gotta consider too, whoever else could be affected by the fact that this infection is out there. So maybe somebody you do care about has been affected, and I can kind of work my magic to get in touch with anybody who needs treatment, and I can do it in a confidential way. So you don't want anybody else who you would be interested in or cared about affected by this, I'm sure, right?
I don't think Bob has it. I think that dickhead Mike is the one that gave it to me.
Why do you think that?
I mean, he was the one that told me to come get tested.
Oh, that's true. Okay, but you know, it could have been that you had this for a while and Mike was affected by that. You just didn't know that you were infected. So back to the discussion about all the people potentially involved getting word of this in terms of the need for, you know, medical care for them. And when I talk to anybody, I can't give out that information. I can't say anything. So he wouldn't know who had given his name. So what would be the best way to try to reach him?
His number is 111-222-3333,
Okay.
and he lives at 123 Park Avenue.
Ah, okay. Well, who else is Bob having sex with as far as you know?
Well, he cheated on me with my best friend Chris.
Aha! Alrighty. And so, do you know where Chris works?
He works at the CVS on Main Street.
Okay. Alright. And how can I get in touch with John?
Well, he moved in with Bob, so you can probably find him at Bob's house.
Oh.
I do not know anywhere else, any other way to contact him.
Okay. Interesting. The plot thickens. How about Tom, Steve, some of the other folks we've talked about?
I'll talk to him, Tom, Steve, Mike, all the people, and just tell them that they need to come and get tested and treated.
Okay. What about anybody else?
I mean, there are others, but they were all on Grindr, and I deleted Grindr, so I don't know how to get in touch with them.
You sure? You really deleted that altogether?
I mean, people change.
Okay. All right, well then let's go back to you. Let's talk about what we could discuss to try to keep you from getting syphilis again.